Hypothyroidism, at its core, is a condition where the thyroid gland, a small but mighty organ located in your neck, doesn't make enough thyroid hormones. These hormones, primarily T3 and T4, are vital because they regulate the body's metabolism. When production dips below normal levels, it throws everything off balance. This hormone deficiency causes the body's systems to slow down significantly. It's like the dimmer switch on your internal lights has been turned way down. Think of the thyroid as your body's engine, the control center for energy production and utilization. When it's underactive, everything runs low and slow. This affects everything from your heart rate to your digestion and even your mental sharpness. The most common cause of hypothyroidism in the US is Hashimoto's thyroiditis, an autoimmune attack on the thyroid. In this condition, the body's immune system mistakenly identifies the thyroid gland as a foreign invader and begins to attack it, leading to chronic inflammation and reduced hormone production. Other causes include thyroid surgery, where part or all of the thyroid gland is removed, radiation, particularly radiation therapy used to treat certain cancers, or iodine deficiency, which is less common in developed countries due to the widespread use of iodized salt. The key lab finding to diagnose hypothyroidism is low levels of T3 and T4, the primary thyroid hormones, but high TSH, or thyroid-stimulating hormone. This is your classic NCLEX clue, a pattern that will help you quickly identify hypothyroidism in test questions. This low and slow pattern explains all the symptoms associated with hypothyroidism, from fatigue and weight gain to constipation and dry skin. Recognizing this pattern is essential for safe nursing care, allowing you to anticipate patient needs and provide appropriate interventions. Recognize the feedback loop at play here. Low thyroid hormones trigger high TSH levels as the body tries to compensate and stimulate the thyroid to produce more hormones. It's a signal that the thyroid gland isn't responding adequately. Mastering this concept is crucial for both the NCLEX, where you'll be tested on your understanding of endocrine disorders, and real-world nursing, where you'll encounter patients with hypothyroidism and need to provide informed and effective care. When you're prepping for the NCLEX, it's not just about memorizing facts, it's about understanding the underlying mechanisms of disease. Hypothyroidism at its core means everything slows down. Think of it as the body's engine running at idle. So, what are the key symptoms to watch out for? First, profound fatigue. This isn't just feeling a little tired, it's an overwhelming sense of exhaustion. Then there's unexplained weight gain, even without changes in diet or exercise. And bradycardia, a heart rate that's significantly slower than normal. Patients often feel cold, even in warm environments. They have dry skin, sometimes to the point of being flaky and itchy, thinning hair, which can be quite distressing for patients, and brittle nails that break easily. Mentally, look for depression, as hypothyroidism can significantly impact mood. Memory problems, including difficulty concentrating and remembering things, and slow speech, which can be subtle but noticeable. Constipation, due to the slowing down of the digestive system, and heavy menstrual periods are common in women with hypothyroidism. Myxedema, puffy, waxy skin, especially around the eyes. This periorbital edema is a key indicator, is a hallmark sign that shouldn't be missed. Goiter may develop as the thyroid tries to compensate for the low hormone levels. These symptoms develop gradually, often over months or even years, so don't dismiss them as normal aging. Recognizing this low and slow constellation of symptoms is critical for NCLEX success and, more importantly, for providing excellent patient care. Always connect the symptoms back to the underlying slowed metabolism to truly understand hypothyroidism. Diagnosing hypothyroidism hinges on labs high TSH, low free T4. TSH rises as the pituitary tries to stimulate a failing thyroid. Free T4 is the best indicator of thyroid function. A radionuclide scan shows decreased uptake in hypothyroidism. Differentiate from hyperthyroidism, that's high and fast. Weight loss, tachycardia, anxiety, and low TSH with high T3, T4. Remember, hypothyroidism is slow with high TSH. Hyperthyroidism is fast with low TSH. Use this framework to quickly analyze NCLEX questions. Link symptoms and labs to the metabolic state for accurate diagnosis. Treatment for hypothyroidism is typically lifelong. It's important to emphasize this to patients so they understand the long-term commitment to managing their condition. Consistent medication is key to maintaining stable thyroid hormone levels. The primary medication used is levothyroxine, a synthetic form of T4, the thyroid hormone that your body isn't producing enough of. This medication replaces the missing hormone and helps restore normal metabolic function. It's crucial to teach patients to take it on an empty stomach. This ensures optimal absorption of the medication. Food can interfere with how well your body absorbs levothyroxine, reducing its effectiveness. Ideally, take it 30-60 minutes before breakfast with a full glass of water. This timing allows the medication to be absorbed before food enters the stomach. Avoid taking it with antacids, as they can also interfere with absorption. Certain medications can bind to levothyroxine, preventing it from being properly absorbed into the bloodstream. Also, avoid taking it with calcium supplements or iron supplements. These supplements can bind to the levothyroxine and prevent its absorption. Start low, go slow when initiating levothyroxine therapy. This is especially important in elderly patients or those with cardiac conditions. Starting with a low dose and gradually increasing it helps minimize the risk of adverse effects. Monitor for chest pain, as rapid increases in thyroid hormone levels can sometimes exacerbate cardiac issues. Also, watch for palpitations, which can indicate that the dose is too high or that the patient is experiencing adverse cardiac effects. Adjust the dose based on TSH levels. Regular blood tests are essential to ensure that the medication is effectively managing the hypothyroidism. Never stop medication abruptly. Doing so can lead to a sudden drop in thyroid hormone levels. If medication is stopped, symptoms will return and can worsen, potentially leading to severe complications. Educate patients on the signs of both under and over treatment. Recognizing these signs allows for timely adjustments to the medication dosage. Supportive care is also important. Keep patients warm, as hypothyroidism can make them more sensitive to cold. Encourage fiber and fluids to help manage constipation, a common symptom of hypothyroidism. Moisturize dry skin, as hypothyroidism often leads to dry and flaky skin. And promote rest, as fatigue is a significant symptom. These steps ensure safety and comfort for hypothyroid patients, improving their overall quality of life. Myxedema coma is a life-threatening emergency. Everything slows to a critical level. Triggers infection, surgery, trauma, or stopping thyroid meds. Signs: severe hypothermia, bradycardia, hypotension, respiratory failure, altered mental status, and myxedema. Prioritize airway. Intubate if needed. Give IV levothyroxine and fluids. Oral meds won't absorb. Warm passively with blankets, not heating pads. Monitor vitals, glucose, and treat underlying triggers. For NCLEX, remember airway first, then IV hormone and circulatory support. Act fast to save lives.